So shall we start?
Yes.
Okay, so we have 6 plus 3 minutes. Okay.
Yes. Hello, good evening.
Good evening, doctor.
I am Dr. Morshida, one of the doctors here working in the child unit. So am I talking with Mrs. Clara?
Yeah, yes, doctor.
Nice to meet you, Mrs. Clara. So first of all, I want to congratulate you for your for the baby. And
Thank you,
yes,
doctor.
so
Thank
how
you.
do you how do you feel now?
Yeah, I'm better now, doctor. I had some pains initially. Now medicine's time. Okay, doctor. I'm comfortable, doctor. Thank you.
That's great. That's great. So I have some information that baby having some problem was noticed on day 5 test by the health worker. So do you have any idea about this? Can you share with me?
Yes, doctor. I noticed some swelling on the right arm of my baby, doctor. Then I informed the health visitor, and then they told me to take to the hospital, and now I'm here. You, doctor. Like that's all I know, doctor.
Sorry, I could not hear you in between time. Can you please repeat last
Yes, doctor. Like
line?
I noticed some swelling, doctor, my
Mhm.
home after discharging. Then I informed the health visitor, and
Mhm.
your unit back, doctor, and
Someone is talking in between.
yes, can you please mute yourself? Yes, doctor.
Yeah, I'm really sorry to hear. And X-ray was done. And I'm sorry to tell you that there is a fracture was noticed through the X-ray.
Oh my God. What, doctor? You're telling something serious? Is it something serious, doctor? Oh,
Actually, I'm really sorry to say, but it's something not very serious, but we have to address these things immediately.
okay, doctor.
Yeah.
Okay, doctor. Oh my God, my baby is in pain, doctor. Okay. How did it happen, doctor? Like the baby was born in your unit and I was discharged, everything was okay. Then how this thing happened, doctor?
I can really understand that you are very much worried. So actually, I can hear just comment on this that child was very big. So during this time, any problem happened or not? I'm not sure at this stage. But so it was difficult. I mean, 4 kg child, so it could be difficult to be delivered. So I have to take this information um, uh, from the
Yes, doctor.
departments.
They told me that baby was quite big and sometimes the baby delivery was quite difficult. But they told everything was okay, doctor. Then suddenly, how this thing happened, doctor?
I can understand your worry. So there is sometimes when the delivery is difficult, that times to save the life, we have to do the manipulation, and doctors try to take out of the baby. So some problem could be happen that times. We just get fractured, and we will talk about these things with our respective department.
Mhm. And doctor, if this thing happened during delivery, then why was this thing missed, doctor? I was there in your unit for 2 days. Nobody told me anything, doctor. I'm just a
I'm
bit
really
concerned,
sorry
doctor.
to hear. I'm really sorry to hear about these things. Actually, after delivery, child having was big, and child having many water inside the body. So that times it could be missed. So through the examination, sometimes it is not possible to pick out if there any fracture. You know, it is a very delicate situation.
Okay, doctor, is it painful, my baby, doctor? I'm just concerned, doctor, because it is a very small baby. It is a newborn baby, doctor. Is it painful, doctor? Does my baby feel very?
Yes, so it's very appreciable that you are very concerned with your baby. But at this time, usually child would not, I mean, at very early age, so the child had not that much pain sensation. And if child having any problem, then child should be crying, and it is not there also.
But my baby was crying, doctor, when I was touching that area. My baby was crying. That's why I found the health visitor also.
Okay.
So,
Yeah.
doctor, I would just have a doubt, doctor. Will you do any surgery for this, doctor? Like, what are you planning, doctor?
So, yeah. So now we have to involve our consultant, and we will refer to the bone doctor. Bone doctors will take the subsequent decision to how to manage this fracture. And also I will involve our consultant so that we can take the appropriate decision in this regard.
Okay, okay, doctor. Then you mean to say that the bone doctor will come and see, and again, then only you start the treatment, doctor?
Yes, so if bone doctor can give some, I mean, they will better explain, but they can put cast if it is required. According to the X-ray report, they will take their decision. Bone doctor will take the decision.
Okay, okay, doctor. Doctor, I am also a bit concerned, doctor, what my neighbors and relatives will think of me. Is it any part of mine, doctor? I'm just worried, doctor. Will they blame me, doctor? Is there anything am I to blame, doctor?
I can understand that how much difficult this situation is for you, but I can say that as there is some difficult delivery and a fracture was happened, and it's so for sure it is not no one is responsible for this, as there is hospital delivery, and for sure you are not responsible for this, and you are very concerned, mom, until you are until you are good in parenting. In that cases, no problems will happen, and no authority will be interfere within this.
Okay, okay, doctor. Doctor, I also hear that sometimes doctors, inform to the social service if there is any injury to the kids. I'm also afraid, doctor. Are you going to inform the social service, doctor?
So actually, social service is social service is very important to take care of the baby. So they are not interfering anyone until the child safety is compromised. So as we get here a fracture, and also social service here involved or will be involved or not, I have to talk in this regards with my consultant and can come back to you. But I want to reassure you that social service is for the best interest of the baby. And as if you are sincere about and the child, and you are taking care of these, then there is no harm to known by the social service.
Okay, doctor. Thank you so much, doctor. Doctor, are you going to give some medicines, doctor? Because I think my baby will be in pain. Are you going to give some medicines, doctor, or I have to wait?
Okay. So, as child having this fracture, so we have to again
यह
we
हटाओ
want
ना
to again examine.
कि मैं अपने घर रख लूं और मतलब
We have to. So you have to again examine and if child having any other problems, we have to evaluate appropriately. So we'll do some investigations as well if our examination findings having any abnormality. Then we'll take the decision of giving other medications. But for the pain, we can advise paracetamol.
Okay, doctor. Thank you, doctor. Thank you.
So today we discuss many things, but to make it more easy for you, can I make a small summary?
Yeah, yes, doctor.
Okay, but before that, do you have any other concern, please?
No, doctor. I just want my baby to be fine and back to normal.
That is very appreciable. Here today we discuss many things about your baby's having a fracture, and we here I said that child will be referred to the bone doctor. And also I will make this arrangement to another meetings with the consultant, and I will come back to you details about social service aspects. And also we're going to give some medications, for example, paracetamol, to help your baby to relieve of pain. And so I can give you some trusted website about the child having when the child having fractured humerus. So how can you help her help the baby? So I'm just wishing your child's rapid recovery. Thank you.
Thank you so much, doctor. Okay, yes. So you're almost on time, so 30 seconds extra. Okay. So how did it go? How do you feel? What your performance?
Actually, I was first thinking that it's a non-accident injury scenario, but I was confused that no, it is only a one fracture, no information is there. And the scenario is new to me, actually.
Okay.
So a little bit confused as well.
Okay. It's good that the new scenario you almost managed it. It's good. Okay. Now others, any feedback?
So just one question rather. In this
Yeah.
scenario, could she have asked a question to Mrs. Clara in a very indirect manner? Like, does she have any idea how her baby could have got this injury? Because accidental injury, any fractures in a non-mobile child is always suspicious. So
Okay.
can a question be asked by the candidate, asking the mother if she has any idea how the baby could have had the fracture? If she says no, then we can proceed as she has proceeded. Is it?
Okay.
I'm just asking.
So your question is whether can we ask the role player how the injury could have happened, right?
Does she have any idea how it could have happened? Is there a possibility that the baby could have got injured at home anytime after she got home?
Yes. See, the usual thing is we are not allowed to ask any further questions to the role player. But in a scenario where you are suspecting NAI, you may ask this one question. Okay. But if you take this scenario, you have a birth weight of 4 kg and the mother has noticed a swelling and she has brought it to the attention of health worker. So this is something quite away from that line. Okay. So if you have maybe more than one fracture, or if the scenario is more towards an NAI, then you can ask the question instead of directly blaming the parent that this is an NAI, we are suspecting something like that. you can ask a question like, would you like to tell your side of the story, how this would have happened? So that's a polite way of asking their own side of the story. So that question could well be asked if the scenario is an clear-cut NAI, okay, non-accidental injury. But here, I think that question is not required.
Yeah, I think because the scenario is more of addressing her concerns, and it
Yeah.
says that there's not expectation of gathering more information. So wouldn't beat around all that. Just would be addressing her concerns, and yeah, maybe I would just politely once ask like if she knows about how it might have happened, but considering that the baby is huge, and possibly at birth that injury might have happened.
So, but that's a good question. We need to ask that question. That question is allowed in a scenario where we are clearly thinking of non-accidental injury. That's an exception to the usual rule.
But is it possible that a injury like a fracture humerus be missed in a hospital after 48 hours?
No, it depends, right? So that is also one of my question, right? Why was it missed? Like the role player will ask you, like, why was it missed, doctor? I was there in the unit for 1 or 2 days. Why was it missed? So in this scenario, like what we can tell is you can once apologize. We apologize that it is missed. Sometimes the baby may be sleeping in the first 1 or 2 days. So the baby may not be moving the limbs actively when we are going for the visit. So sometimes the edema may happen slowly later, but so these things can be the reasons which can be given to substantiate your reason why it is missed. Okay. So see this scenario I brought it because I want to bring it the either way. See the same scenario, if the role player is very aggressive, if he is asking why was it missed, doctor, I want to know who is the doctor who examined my child, I want to raise a complaint, then this will become something like a critical incident, something like that. Okay. So my point is like when you read the scenario, sometimes people might think that this is like the alternate role player will be very aggressive. They will ask the doctor, they will go for complaint, so on and so forth. But sometimes the scenario may twist like this, where the role player may think very bad. Maybe she may feel guilty of missing it, something like that. The scenario what we had now. So in that scenario, we will not go in those lines. So the answer for your question, like what we can tell is the baby was sleeping. Babies usually sleeps in the first 2 days. So baby might be sleeping when the doctor examines, may not be moving limbs. The doctor was examining the baby. So sometimes the swelling happens slowly later after the fracture has happened. So that could be the reasons we could give. But you can add a line like we are raising a critical incident. We will surely look into it so that we don't miss any incident like this in the future. So that can be added. Okay. Is that clear?
Yes, yes.
So any other feedback?
Yeah, I would ask, I mean, in this scenario, I would obviously be more empathetic and gentle and be slow in saying that. I mean, I would obviously ask the baby's name instead of addressing that her baby, that if the baby has a name, congratulate her, actually be concerned about how she is and things, because she must have had traumatic delivery. Because if the baby was 4 kg, I would clearly discuss my role about what I'm going to talk about today, and repeatedly ask her, empathize a lot in between, ask her if she's understanding what I'm trying to say, and check with her all the time.
I think the today's doctor, I think we try to congratulate and do all those things. Maybe in between, you can add one line. Are you able to? Are you following me? Or are you able to understand this? Those things, 1 or 2 questions can be added. Otherwise, like there was a pause in between, and it was okay. But still, as you said, there can be a question added in between, like, are you able to follow me? Are you able to understand? Are you comfortable? That you can ask. Yes. So, any further feedback? Okay. So there was one question, right? Is it painful for my baby? Like in those questions, like you can tell that we will give some medicines, tell paracetamol also, but we can give some medicines to ensure the comfort of your baby, like that we can tell. Okay, so for that we need not wait. As you already mentioned that you involve the bone doctor and your consultant. Okay. And the social service question, it is more of a guilty scenario. Okay, so in that scenario, you can tell like as of now, we are not thinking in those lines, but I will discuss with my consultant, and I'm like you can tell the mother that as of now. So that word as of now is because there is only one fracture, and the mother has brought the baby to the hospital. So in that way, you can reassure her that as of now, everything is fine, but we will definitely involve the consultant. And in case the social service is getting involved, we will let you know. So that will be the right way to proceed in case social service is brought. Okay. So say for example, in the same scenario, if the mother is telling, I want the doctor, I want like to get a complaint. So what we can do in those scenario?
Patient advisory license.
So you can try to convince, as you told well initially, you can tell the reasons. Okay, the baby is big, sometimes difficult delivery that can cause sometimes a fracture. So sometimes a prolonged delivery or those things can be a fracture. So that thing you can tell. You can try to tell twice. Okay, in those scenarios when when there is no mistake on the part of the treating unit, you can try to tell twice. But if the mother is insisting third time, then I think that's the time you can open the door. You can tell the mother, okay, I will help you with that. I will send my staff nurse with you to assist you with the PAL service, patient advisory and action service. Okay, so that would be the way out. So if you get this scenario, you should not get a fixed thought that this is patient will be angry or something like that. Patient can feel guilty also. So just go with the mood of the patient. Okay, I mean the role player. So if they are more in angry mode, then it will be like a more like a critical incident raising and trying to convince the mother and involving the past service. If the mother is more in the guilty, it is more of an empathetic, like try to convince. So let us not have a fixed opinion outside the communication room. We should go with the flow of the patient. Okay. So I just want to add a few more things. Like if this is in the scenario, okay. Say for example, the scenario told that it was a forceps delivery. Okay. And very well, you know that it is because of the forceps delivery. If the mother asks why forceps is used, doctor, because of that, the fracture has happened. So what is the answer it can give in those scenario?
That mom having forceps delivery. So why forceps delivery?
Yeah.
What's your question?
Yeah.
So actually, I think I should not ask this. Why forceps delivery?
No, like you are not.
It is not my task. So why? But if mom is asked this, if mom asked me, then also it's not my job to why forceps delivery or something like this. But sometimes it is required. I can say that sometimes it is required because delivery become difficult, especially if there is big baby. So sometimes it is required.
Okay. So that's a good way of answering. But let us not tell that it is not my job. We can tell that in those scenarios, we have to decide between saving the baby versus a fracture. Okay. So always try to bring comparison. Okay. So the forceps would have been used because the lady doctor would have felt that baby need to be saved. So that would be an indication for the forceps. So we need to pull the baby fast. So sometimes these fracture may happen. So that's the way you can go for it. Okay. So just try to compare.
I just wanted to ask, because it's not as a team, like as a pediatric team, we are not delivering the baby. So is it appropriate to say that I'm so sorry that forceps was used and you feel that way, but I'm really not sure about why the forceps was used.
Yeah.
But I'm pretty sure that it must have been used in appropriate situations.
Yes.
But in a few deliveries, it might happen this way. Like we can keep it this way, isn't it?
We can keep it that way. You can also tell the adult that I can set up a meeting with the gynecologist in case she wants to ask about why it was used. But you can always bring a comparison between having a baby with asphyxia or a difficult delivery versus having a fracture. Okay, so that way we can we not blame our colleagues also. Okay.
Yeah.
So imagine that if there's a similar scenario with say for example baby with preterm baby maybe having a fracture, maybe say for example some 2 months later. Okay. So what are our thinking in those scenario?
Child abuse.
Okay. Okay, NEI is one possibility, but will we go straight to non-accidental injury or we have some other things?
Yeah, I would
We
think
have
about osteopenia of
ICU
prematurity. Yeah.
Yes.
Yeah, exactly. Good. Yeah. So before jumping into NEI, we should always think of other things, like say, for example, osteopenia prematurity, like maybe preterm baby should have, maybe baby was on steroids for something else, for diuretic. So these drugs may cause some weakness of bones. Maybe baby may have vitamin D deficiency. So those things should be in our thought. Okay, we should not straight away blame the mother. But if the scenario is having a recurrent fractures and different fracture lines in X-ray, those things are there, then okay. But still, we have to think of these conditions as well as some, say, for example, an osteogenesis imperfecta, which can cause a multiple fractures. So those things should be there. Like we should not straight away go and blame the parent. Instead, we should think of all these differentials, and then we can tell the parent that if it is request, we may involve the social services to go for further. We may do a full body X-ray, so on. So, okay. So we will stop here. Any further questions in this scenario? Okay. So who's doing communication next? Is doctor ready for communication? I mean, for the clinical station?